It's time for another Morning Pointe Foundation Caregiver Café, part of the work of the Morning Pointe Foundation, providing nursing scholarships and caregiver support programs across the Southeast. Thank you, donors, for supporting our 4 annual Seniors Got Talent shows and our 2 annual golf events. And now, bi-monthly virtual caregiver cafes featuring senior living experts. This episode features Mr. Andrew Klope, a senior occupational therapist specialist. Mr. Klope is a therapy program manager with HealthPRO Heritage Rise Senior Living. He will be focusing on the effects of active engagement on aging seniors and how it impacts health and fitness, cognition, and behavioral health. Andrew Klope has spent the past 10 years specializing in geriatric therapy, particularly in assisted living and independent living facility settings. He holds specialty certifications and training in memory care and dementia care, and is an LSVT, Lee Silverman Voice Training-certified for Parkinson's disease interventions. Please welcome Mr. Andrew Klope to the Morning Pointe Foundation Caregiver Café, and be sure to stay to the very end to get all of your chat questions answered on today's topic, the importance of exercise and active engagement as we age. Welcome.
Hi, everyone. Thanks so much for joining us. I'm Andrew Klope. I'm an occupational therapist with HealthPRO Heritage Therapy out of several of the Morning Pointe locations here in Tennessee. Today, we're going to be talking about how important it is to maintain an active, healthy level of exercise throughout the entire spectrum of our lives and how big of an impact it can have on us as we age. So I'm going to go ahead and start by sharing my screen. There we go. Okay, and I also want to start by thanking the Morning Pointe Foundation for putting this on. It's an important topic, so I appreciate the time. Today, we'll be talking about why it's so important to maintain a high level of physical activity and active engagement as we continue to age. Most of us know that it's important to exercise and to stay active. We've known that since we were young, since we were teenagers. We've probably back then attributed it more to wanting to look good than to live long. But now, as most of us have gotten older, we're well aware how important it is to exercise, but most of us don't know just how important it is and how big of an impact it can have, not just on our bodies, but on our minds as well, and on our quality of life and on our happiness. Today, we're just going to really dig into just how important it is. During my talk, I'm going to focus on 3 major aspects of why maintaining a high level of exercise and activity are so important for us as we grow older. So those 3 major points are going to be how exercise affects us physically, how it affects our bodies, how it affects how we live physically as we age. We're going to talk about how it affects us cognitively, how it affects our minds, how it can be a significant factor in staving off dementia and making existing dementia symptoms better. We're also going to talk about how it affects us emotionally, how it can influence behaviors, how it can affect our overall sense of happiness and self-worth, no matter where we are. And then we'll finish up by talking about how you can make exercises work for you, whether that be at home, whether that be in an assisted living facility environment, whether you're trying to help someone as their caregiver, you're trying to help motivate them or find things they can participate in, all the way up to helping someone that you know or love that is living with dementia and maybe isn't able to participate in a standard exercise program, ways that we can engage them, keep them active and fit, and how that can benefit them cognitively and emotionally. All right, we'll start with the impact and benefit of regular physical exercise on our bodies. So the loss of strength and stamina that we often attribute to aging is actually caused more by a lack of physical activity. A lot of us just assume that when you get older, you get weaker. That's only partially true. You know, our bodies do change as we get older. But the reality is most of that loss of strength and coordination is more attributed to not being active. Inactivity definitely increases by age. By age 75, 1 in 3 men and 1 in 2 women engage in little to no physical activity at all. That's a huge number. Adults over 65, the ones that are active, their primary activities are walking, gardening, yard work. which are all great and we strongly encourage, but that's, a pretty significant difference from when we're younger, especially working like in a physically demanding job or chasing kids all day. And finally, on this slide, one of the biggest factors in maintaining a healthy lifestyle of exercise is having somebody do it with you. Social support from family and friends has been consistently and positively related to regular physical activity. That's true for us at any age. I know that if I have a partner to go work out with me, I'm more likely to not hit the snooze button in the morning. A lot of our seniors are more likely to go for a longer walk than they maybe would have on their own if they're trying to keep up with somebody or motivate a friend. All right, we'll start out with cardiovascular health. Heart disease is a leading cause of death for both men and women in the United States. It's responsible for 1 in 4 deaths. It's a huge number. Regular exercise, though, can slow the heart, it can lower blood pressure, it can ease stress, boost morale and your mood, which further lowers stress, improve oxygen efficiency, and it can help a person lose excess body weight, which in turn helps reduce the amount of strain put on the heart from that excess body weight. It can promote quicker recovery times and sometimes can even reduce the need for medication for the heart. Even a moderate intensity exercise program, if it's followed on a regular basis, produces favorable effects on several health outcomes. And that's one thing we'll touch on more during this program, is that the point of this is not that we all need to be training for a marathon into our 90s. The point is regular, consistent, moderate exercise, manageable levels of exercise, nothing that makes us miserable, but making sure that it's every single day we get off the couch, we do a walking routine, we do some form of exercise to maintain that strength and resilience as we get older. Going further into cardiovascular health, adults over 65 years old are much more likely than young people to have heart disease. Part of that's because of how the heart changes as we age. But heart disease is a significant cause of all disabilities, according to the National Institute on Aging. And they note that it can affect the ability of millions of older people to be active and have a good quality of life. We'll touch on that some more later, but it goes hand in hand. Improved exercise improves cardiovascular health, but also getting to the point of poor cardiovascular health can make it to where people are less likely to be active, and then that spirals downward. One study from the Canadian Journal of Cardiology showed that seniors gain the most physical and psychological benefit from rehab programs, yet they receive the least representation. I think a lot of that is, a young person gets injured and we expect them to fully recover and get back to a full and active life in most situations. But a lot of times when someone's older and they break a bone or their hip or have a new diagnosis of some heart disease or stroke, we sometimes don't expect them to get better with the same level of expectation as we would for a younger person. That's not how we should be. We should be pushing for us all to receive the same amount of rehab and exercise, because it really can benefit the elderly even more. A younger person is more likely to spring back even without therapy, just from the body's natural healing, whereas an older person will get more benefits because they require a little bit more effort for the improvement. All right, another impact, regular exercise has been shown to reduce the risk of dying from coronary heart disease and developing high blood pressure. I think most of us know that in general, but the levels that it affects us are very significant, especially aerobic exercise, endurance exercises. In the healthy elderly, it can have multiple effects on several different health outcomes, including reduction in the decline in cardiovascular performance that we usually associate with aging, and an improved physical function. Several studies have shown increased VO2 max, increased cardiovascular performance, increased strength, increase all sorts of different parameters of heart health and fitness with just a moderate amount of aerobic exercise. And that regular significant exercise is especially important during periods of illness and injury. I touched on this a second ago, but as we get to a certain age, an injury or a serious illness or a new diagnosis can kind of lead to a downward spiral that we see a lot, where someone is knocked off base by something new, like a fall or a new diagnosis, and they're less active. And that leads to continued decreases in strength and increased risk of fall, increased risk of getting sick from decreased immunity and things like that. That's where therapy steps in, and we'll go over that later. But one good example of that is sarcopenia and frailty. Sarcopenia is a geriatric syndrome. It's very commonly very common in the elderly, but it's characterized by low muscle mass, low muscle strength, low physical performance due to a lot of different factors: progressive aging, nutrition issues, being sedentary, chronic diseases, diabetes, that kind of stuff. And it leads to disabilities. It leads to risks of falls and fractures and death. It leads to frailty, which is a geriatric syndrome characterized by increased vulnerability to adverse health outcomes. It's basically saying when somebody is medically frail, it's saying that any new health outcome that's negative could really knock them off base, can really send them downhill because they're just barely making it. But on the positive side of that, several studies have found that in sarcopenic and frail patients, resistance exercise training, which sometimes you'll see us document as RET, that's capable of improving lean tissue mass, muscle strength, and several other performance factors, all the way up to like the 6-minute walking test, stair climbing, aerobic capacity. This study is essentially showing that even in someone who would be considered medically frail, someone who a lot of us would look at and say they're on death's door, that person can significantly benefit from a exercise program, from increasing their strength, from working on building up their muscle mass. In the medium and the long term, those interventions can improve quality of life, functional independence, improve their risk of falls, their gait, their balance, even improve things like depression. These studies are showing that even when very frail, it's important to have regular exercise. It cannot be understated. And I summed it up here: use it or lose it. I think we've all heard that, but it's extremely true. It has other impacts on our bodies a lot of us don't think about, like on our bone and joint health. Preventing bone loss. A lot of us know that, especially women, as we age, lose bone density. Postmenopausal women can lose up to 2% each year. So having stronger bones leads to fewer fractures and can also aid in increased balance. It reduces the risk of falls and injuries. And exercise can help seniors to live independently for longer, because the way that it affects bones is the more stress and strain you put on your bones, the stronger they get. As long as you're not going too far with like a fracture or something like that. But in general, being non-sedentary, putting active stress, movement on our bones increases bone density. Olympic athletes have the densest bones of anybody else on the face of the earth. Prehistoric humans who were constantly under tons of muscular stress had much denser bones than we do now. It's because your bones respond to that load. Falls with injuries and fractures frequently lead to a long-term decrease in activity, which, like I said, can cause that downward spiral. This is where therapy often steps in to help after something like that. And it's why it's so crucial to continue to exercise and maintain your program long after therapy discharges, and why it's crucial to do so before you ever have the need for it. Like I said, increased bone density can help prevent the need to ever have to see us. Increased exercise actually can relieve osteoarthritis pain. It sounds counterintuitive, but it's true. Moving can actually help lessen pain and stiffness from arthritis. You need to make sure that you're focused on arthritis-friendly exercises and include low-impact cardiovascular activity, strength training, and range of motion exercises. So we're not going for heavy-duty exercises that have a lot of load on the joints. We actually want to just focus on the support muscles that are around the joints. That helps to take the pressure off of the aching joints by strengthening the surrounding muscles and tissues. It gives them a better support base. Physical activity can help ease inflammation and aid in lubrication around joints as well, which reduces pain and stiffness. Essentially, you can move it or lose it. Another way that we say that a lot is motion is lotion. Okay, let me just move on to the next one. Okay, and then fall prevention, which I touched on briefly. Resistance and strength training is particularly effective in increasing muscle mass and strength and improving several measurements of physical performance. There's been a lot of studies on that, but essentially integration of balance and strength training in your life appears to particularly be efficient in reducing the rate of falls in older people, and especially people with disabilities. That's why it's so important to find the just right level of activity for each individual person. There are many situations where a person is not safe to perform regular high-level balance activities. I see that all the time, where we can do certain exercises in the therapeutic gym in our clinics at Morning Pointe that someone definitely wouldn't be safe to do at home, but we can push them beyond that base level. But even if you're not able to do that, if you're not able to participate with somebody helping you, you can participate in seated exercises. It doesn't mean you should do nothing just because you can't do the maximum of the recommended. You can do seated, chair yoga, reaching, leaning, all kinds of stuff. And we'll go over a lot of that stuff later, some ways you can adapt exercises to make them work for you. And finally, for the impact on our bodies anyway, it helps with your immune health. A lot of people don't realize that. Part of that is because we don't really understand why. We don't fully understand how it affects us, but significant regular exercise helps prevent chronic diseases. It can help protect against a whole host of different chronic illnesses, including, obviously, I said cardiovascular disease earlier, but even things like cancer, diabetes, obesity, hypertension. A lot of those build off of each other for continued decreases in function, and they affect each other. So being able to prevent one sometimes can help stave off others. And again, there's been a lot of studies that show that it's effective. They just don't really understand the mechanisms why yet. But in this study from 2018, it did show that people that were active generally took fewer sick days off work. And again, the exact way was not supported. All right, we're going to move on to the impact exercise has on cognition and on cognitive function. Of all the lifestyle changes that have been studied, participating in regular physical exercise appears to be one of the best things you can do to reduce your risk of getting dementia. I put that in bold because that is an amazing fact that a lot of people don't realize. It is the most significant thing you can do to help with dementia. Several long-term studies have looked at this. The first one I have listed here is a meta-analysis of 11 different studies on the subject. And it showed that regular exercise can significantly reduce the risk by 30%. That's huge. And specifically for Alzheimer's disease, 45%. Almost a 50% reduction in risk from regular exercise. If it's something that you're already almost doing or you think is important, that cannot be a bigger factor in making it important for you, and just how much it affects us. One particular study looked at the health behaviors of 2,000 different men. I believe this was in England, followed them for over 35 years. So a full long-term study of their adult lives. They assessed 5 different behaviors, which included the amount of exercise they got, whether they smoked or not, how much alcohol they took in, their overall body weight, and their diet. And out of all those things, exercise had the biggest effect in reducing dementia risks. I would have definitely, without reading that study, I would have immediately said, smoking or alcohol intake. But the reality is exercise is even more important than those. It followed that for people that followed 4 or 5 of the above behaviors. So people that ate healthy, exercised frequently, didn't smoke, drank moderately, were 60% less likely to develop dementia overall. Why does it affect cognition? One of the main reasons is it increases the rate of blood flow to your brain. It increases the amount of oxygen and nutrients that get to your brain because it increases the vascularization as your blood flow increases with that exercise and increased flow. It also releases beneficial proteins in the brain. These proteins can nourish brain cells, also known as neurons, and keep them healthy and promote the growth of new neurons. Neurons are working building blocks of the brain. As a result, individual neuron health is important to overall brain health, and anything that helps neuron health helps brain health. In a 2019 study by the University of Wisconsin School of Medicine, they found that moderate exercise is not only good for improving and maintaining good memory in people as they age, it also appears to help prevent development of physical signs of Alzheimer's, known as biomarkers, for people that are at risk. So that's significant in a way that it's not just someone looking at a study of how they perform on a cognitive test. A lot of cognitive tests, they're very accurate, but sometimes it's hard to definitively make a line of exactly where somebody is. Whereas these are physical biomarkers that were affected by this. This is showing a measurable lab study that showed a decreased risk of Alzheimer's in people that have regular exercise, which is amazing. Another important question that I get a lot is it too late to start exercising? Am I too old? I'm 85, I'm 89, I'm 92. Am I too old? And the answer is no. You can receive benefits from regular exercise at any age. It can affect your cognition at any age, including when we're younger. Kids in high school have been proved, I don't have this study listed, but High school kids have been proven to have better cognition, better performance on testing if they participate in regular exercise like sports and cross training, things like that, running. And the same is true for seniors. At 90, it's probably too late to prevent the effects like you would have been able to if you started at 65. But it doesn't mean that you can't have a boost or benefit or prevent further effects if no matter how old you are. In one study of 716 people with an average age of 82, people who were in the bottom 10% in terms of daily physical activity were more than twice as likely to develop Alzheimer's as those in the top 10%. So people that were sitting around were doubly likely to get Alzheimer's as people who were actively moving every day. Another review found 27 studies that looked at the effects of physical activity on brain function in people over 60. And out of those 27, 26 studies showed a clear link between physical activity levels and cognitive performance, suggesting that exercise might be an effective way to reduce cognitive decline later in life. All right. And finally, we're going to talk about the impact exercise can have on our emotional health, on our behaviors, on our happiness. The impact physical exercise and active, engaging activities and lifestyles can have on our emotional well-being is underestimated. A lot of people just don't even realize it at all, and the ones who do know that it affects us oftentimes don't understand how much. More than 2 million of the 34 million Americans aged 65 and older suffer from some form of depression. It can be triggered by chronic illnesses that are common in later in life, like Alzheimer's, Parkinson's, heart disease, stroke, and cancer, arthritis. Older adults are at significantly higher risk for developing depression than younger adults. But I want to stress this because this is a daily part of my job, is to stress that that doesn't mean it's a normal part of aging. Just because older people are more likely to develop depression doesn't mean that it's normal to be depressed. It's a treatable condition. It's not something that as you get older, you're meant to be sad. It's something I actually do encounter quite a bit. A lot of people who feel that way. But it's something that can be overcome or worked on and improved, especially with exercise and especially with active engagement in the community. Activity and exercise have been shown to significantly reduce the incidence of depression and improve symptoms in people who are already experiencing it. And how does it affect mental health? Well, simply put, it makes you feel good. It can ease anxiety and depression. It can increase the level you're relaxed, your body relaxes, and your mind relaxes. And it creates a sense of overall well-being. A 2019 study from McMaster University of adult men over 65 found that the mood-boosting effects of exercise can continue well into old age. So that really underscores why it's so vital. That study showed that no matter what the age, everybody in that study was over 65, and it showed significant benefits in mood from exercise. And I have a quote here from Dr. Craig Miller from Harvard Medical School. And in that quote, he had said, for some people, it works as well as antidepressants. He went on, that's a very short summary. He went on to clarify that it's not a replacement for antidepressants, it's not a replacement for medicines, but that in severe clinical depression, it can be extremely useful. And preventing and managing depression sometimes can make some medications less needed. And in moderate depression or like some of the normal age-related depression, it can really be as effective as medications, especially if used in tandem with medications. It can really help people get over that. How does it affect our mental health? Again, I'll go into that. It's been shown, and this is not what we're relating it to, but high-intensity exercises can give us what's called a runner's high. You see endorphins released in marathon runners who hit that wall and then get past it, and all of a sudden have this feeling of euphoria that gets released. The brain releases lots of chemicals when we exercise. For most of us at any age, let alone in senior living, most of us, the real value is not in getting a runner's high. We're not going to hit that level. We're not going to be that intense. But the value comes from low intensity exercises over a long period of time. So rather than running a marathon one day, it's more of a benefit that we're going to be walking around the building 2 or 3 times every single day. That kind of activity spurs the release of proteins called neurotropic growth factors, which cause nerve cells to grow and make new connections in the brain. The improvement in brain function makes you feel better. In people who are depressed, neuroscientists have noticed the hippocampus in the brain, the region that helps regulate your mood, is smaller. Exercise supports cell growth in the hippocampus, which improves nerve cell connections, which helps relieve depression. That's another quote from that same doctor. essentially regular, moderate to minimal exercise, constantly moving though, not being sedentary, helps keep your brain healthy, helps your emotional centers in your brain stay healthy, stay growing, keep from shrinking. All right, and then finally, we're going to move on to the importance of how to, not the importance, but we're going to move on to how to integrate exercise in your daily life. So I'm going to give you some tips and tricks on how to overcome obstacles, everything from the environment you're in, the physical conditions you may have, all the way up through, if you're a caregiver and your person you're caring for is not wanting to participate, how you can help motivate them or help adapt exercises to make them fit their lifestyle, no matter what the situation. So we'll start that. The first question I get all the time is, what is the right amount of exercise? How much should I be exercising? The short answer is, it's different for everybody. Every single person has a different body. They're living in a different situation in a different place. There's lots of comparisons that we can make to help extrapolate and build an exercise program for each individual person, but everybody's different. You want to base it on your past history, your current health, and your situation. We should always strive to be as physically active as possible, but we want to be reasonable. We don't want to expect someone to go way beyond the limit that their body is capable of at their current level of health and activity. You have to listen to your body. One thing I always tell my patients when we're working in therapy, and that applies to anybody in any form of exercise really, is that you want a moderate level of discomfort. You don't want pain. I always compare it to, if you ever did stretches when you were younger, if you ever did toe touches, that burning pain in your hamstrings is uncomfortable, but it's not painful. You can feel the muscles pulling and stretching, warming up. After an intense exercise when you're younger, sometimes you're sore a little bit afterwards, but not so sore that you can't move, not so sore you can't get dressed the next day or go down to dinner. It's the same thing no matter what age you are. If you do a good exercise program and you're a little sore the next day, you just can feel it a little bit, that's perfect. If you can't get down to dinner, or you have to call for more help than usual to get ready, you've probably overdone it. We don't want to push that hard. But also, we don't want it to be so easy that you don't notice, that you don't break a sweat, or that you don't have any kind of change at all. So we want it to be just enough that at a minimum, that it takes a little bit of effort. It makes you breathe just a little bit harder. It makes you feel like it took some effort to complete. The ideal amount typically requires some degree of effort, but shouldn't leave you overexerted. But again, I'll say, and I phrased it at the bottom here, anything is better than nothing. Doesn't matter what you're doing. If it's better than sitting on the couch, go for it. We always want to do the most we can, but you got to start somewhere. Another question I get all the time is, how can I exercise without access to a gym? I'm at home. I don't have weights. I'm in an apartment, in assisted living or independent living. I don't have the ability to bring in dumbbells or a bench press. Really, that's not really applicable to most people in the age group I work with anyway. There's always body weight exercises, doing squats with your body. Even in a young, very fit person, that can be significantly taxing. You can do that in a position where it's safe as well, even if you have a moderate fall risk. I have my patients do squats at the sink, where they can hold onto the sink if they need to, squat down to a chair behind them or a wheelchair, and let their rear end touch the chair, stand back up. And do that, it depends on their health, do that 5 times in a row, do that 10 times in a row. You will feel it burn. You will feel it burn in your quads and in your hamstrings and in your glutes and in your core. That's good. That's what we want. A moderate minimum. We don't want it to be so sore they can't walk. But just that level of exercise that particular exercise, squats at the sink, is a great core strengthening, leg strengthening exercise. Increases the stability in our joints, in our back, in our knees. As long as we're not having significant pain, like grinding arthritis pain, when you're doing that kind of stuff, again, listen to your body. But there's all kinds of programs you can find on the internet. There's lots of resources, like in Morning Pointe. The activities directors can probably help with some of that. Definitely the therapy programs. If you're near me, you can come to me. I can help set you up with that, and we can go from there. Another thing, coming from a home health background, before I did program managing for HealthPRO, I was in home health. You can't carry a bag full of weights with you into people's houses. So we would use household items, everything from a 16-ounce water bottle, which weighs a pound, which is perfect for a lot of shoulder flexion exercises, raising up over your head, all the way going up to like a canned good that weighs a pound and a half, all the way up to a lot of times if we needed a heavier weight, we would use value-sized jar of peanut butter or mayonnaise, 5 to 8 pound jar, but still able to be held in your hand or in two hands, or a half gallon of milk, weighs 4 pounds, things like that. You can make all kinds of stuff around the house safely usable as a weight. Like I said, especially a milk jug, a half gallon with a handle. It's perfect to grab onto, weighs 4 pounds. That's great for doing bicep curls or two-handed exercises. And then yoga, Pilates, those kind of things, especially in group settings, can really help push you beyond what you'd normally be comfortable with while still being very low impact. Even you can be doing a lot of those in chairs or seated positions. We'll go over that a little bit more in a second, some resources for finding those programs, but that's great. It puts a lot of stress on the core, increases stability, and decreases back pain. It helps with digestive health. Like yoga is an excellent thing to participate in, no matter what stage of life you're in. All right, so those were a lot of exercise tricks, but while a lifestyle that includes traditional aerobic and strength exercises is essential for maintaining good health, not everybody is able or willing to participate, especially persons living with dementia. They often struggle to participate in exercise programs. It could be due to mild dementia where they're willing, and I've had people that are very happy to participate in exercises, but can't remember them when I'm gone. Even with a print off sometimes, and in those situations, they either need someone to actively guide them on a daily basis, or we can set them up with activities that encourage exercise. Same thing as someone with more severe dementia who is not interested in participating in exercise at all for whatever reason. They don't think they need it, they don't understand the purpose, or even it's progressed to the point where they don't follow the commands to participate. That's why active engagement in our own self-care and in community activities is so important. The completion of meaningful tasks is often essential for our loved ones with dementia. And I can't harp on that enough as an occupational therapist. That's what we focus on. I know a lot of people probably don't know the difference between occupational and physical therapy, but I usually sum it up to people by saying that occupational therapy focuses on function, completing tasks, doing for yourself, like everything from dressing, bathing, getting in and out of bed, all the way up to cooking, sewing, anything that's a meaningful occupation of your time to complete tasks in your daily life. Whereas physical therapy is more focused on strengthening movement, gait, function, balance. That's how I usually tell people to separate us. So as an OT, this is really important to me. I think I've got more on this in the next slide. Yeah, I do. For many seniors, their daily routine is their primary source of physical activity, especially with dementia. By increasing the level of activity in that daily routine, you're increasing their total level of activity on a long-term basis. It can be very significant and long-lasting. It can significantly affect overall health and performance and happiness. A good example is putting on your pants, lower body dressing tasks. It's hard to do for a lot of people in senior living for whatever situation, maybe decreased range of motion, maybe decreased balance, maybe dementia. There are a lot of people that I see that don't necessarily have pain trying to put them on, but struggle to get their foot through the hole, especially like Parkinson's disease, things like that. And a lot of times as caregivers and helpers, our first instinct is to jump in and help them, to take care of it for them, to make it easier for them, which is great. That's our instinct as someone who loves them, is to take care. But the reality is that's a short-term gain in time management. It makes it easier in the moment, but it's a long-term loss in activity. It applies to tasks that are more difficult too, rather than just long-term disabilities. That applies to tasks that are difficult, but not tasks that are hard because of like long-term disabilities and impairments like pain. If somebody has an injury to their low back that makes them not able to reach very well, we'll adapt so they can do it themselves with like reachers and things. But we don't want to push into pain again. We want to listen to our bodies. But for anybody that is capable, but it's just hard or takes forever and it can drive us crazy waiting for somebody to process how to get their foot through their pant leg, that is a significant level of activity for them. And if that gets taken away, that's that much activity they're not going to have in their life on an everyday basis. So it's much better to train that person to be able to do it themselves, even if it takes 3 times as long. And again, that's where OT can help. We step in with adaptations, with training for caregivers and for the individual on how to make that happen, how to make it feasible and doable in a realistic situation. Not just saying that you should do that, but teaching people how to actually integrate it in their daily lives. Encouraging active engagement and meaningful activity in persons with dementia. So this is another big thing for us OTs. Many of our loved ones participating in regular exercise is not realistic due to cognitive limitations. That's just the reality. Some of them can, a lot of them, a lot of people that I see in memory care can and do, but not everybody. And that doesn't mean that there is nothing we can do to help. Engagement in meaningful occupation is an excellent way to increase participation in activities. And in this case, I'm not talking about just occupation like getting dressed. I'm talking about meaningful occupation. We define that as occupation fills your time as a human. Getting dressed fits in that category. Meaningful occupation is more individualized. It's doing something in some way. It's completing a task. It's a sense of accomplishment. It doesn't have to be something fun. So for instance, folding laundry is a meaningful occupation. It's especially if it needs to be done and you feel good about it after it's done. A lot of times we'll have people do tasks like that, folding laundry or putting away clothes or helping to clean a table or building something, building a project, puzzle, art. It depends on the person, all the way up through something based off their past life. And when they're finished with that sense of accomplishment and sense of doing something meaningful can really help boost overall happiness, but it wakes something up sometimes. It pulls people that you wouldn't think could complete certain tasks into completing them, especially if it's something they've done repetitively throughout their life. In activity-focused dementia care, each person's history and productive activities need to be appreciated, as those activities can still be highly motivating. That's what I was touching on. A lot of times, their previous routines and activities and behaviors can still bring them a lot of meaning and allow for greater likelihood they'll participate. Because if it brings them meaning and they enjoy it, they want to do it, even if they aren't fully understanding it at that point in their progression. One of the goals of therapy is to find that just right activity for each individual person. We tweak those activities to encourage the highest level of physical activity that's safe while still letting the person maintain motivation. So we'll take something that is simple, like putting a puzzle together, and we'll put that puzzle on at a standing table so that person who is not motivated to get out of their chair at all, but is motivated to go through a memory album, old memories, old photos, put a puzzle together, to build a model airplane, whatever the case may be. We'll put that where they need to stand to do it. So they're getting that much more exercise to do it. Or we'll have items, if they're safe to walk alone, we'll have items placed in different locations where they're walking back and forth to move something or help clean. They're physically participating in an activity that is emotionally engaging for them. Some good examples are finding activities the individual actively engages in. That's often based on past history. I already mentioned that, but like painting, gardening, sorting items, cleaning, folding towels, but it can be a lot more than that. This is an example actually from my past work. We had a resident with advanced dementia that had just moved into a memory unit. He was constantly restless. He was agitated all the time. He was exit seeking. He had been there a week or two and they weren't sure he was going to be able to stay because he just could not sit down, and they couldn't convince him to follow commands, to go to dinner, to go to bed when it was time, to get dressed. He was just pacing all the time and constantly looking for an exit. After we worked with his family quite a bit and found out that he used to have a paper route a long time ago. It really, really meant a lot to him. He had it for years, and he wanted to he built a business off that when he was like a teenager, I think. So we set a paper route up for this person. We put papers at the nursing desk with his name on them on a Post-it note, just his first name, and let him go to get those, and he would deliver them throughout the facility. And when he was done, if he was still restless, either they'd pick him back up or he would pick them back up and put them back where they were and start over again. And it kept him occupied, but not in a drone kind of way. It kept him occupied in a way that he was satisfied with. He felt like he was doing something. A lot of times after he finished, he'd sit down and be calm and would be more willing to listen and more willing to participate in the other activities throughout the day. And if he was having trouble later and was agitated, they'd set up his route for him again and he'd go complete it again. And it kept that person walking, kept them active, kept them exercising very regularly, but also helped, again, with emotion and cognition. He was more participatory, more compliant, and happier overall. And he was able to stay there for a long time. Okay. Some other resources that are great is Morning Pointe itself. The activities directors at your Morning Pointe or Lantern, they have excellent resources. Many residents already, I see them every day participating in exercise programs with the activity director. They'll go down for seated exercises, chair yoga on a daily basis. And that is incredibly important to encourage your loved one to participate in. From the very first slide, I think, on this presentation, I mentioned how important it is to have group activity like that. If they have their friends going, even just their neighbors that they don't know that well, and they see the same people every day, there's a sense of accountability and a sense of participation that comes with that. And so you're just that much more likely to continue it and to work that much harder. And so I would strongly encourage anybody who has a family member living in assisted living or is living there themselves to participate in those programs. They mean a huge difference in quality of life for individuals. And I see that on a daily basis. There's a lot of outside resources as well. Lots of great programs in your area, whether you're in a metro area or a more rural area. It may affect the number of programs, but almost every kind of area has something. Fitness programs like Silver Sneakers, Rock Steady Boxing for Parkinson's, which is great, and others that are tailored to older populations' needs and abilities. So these programs are often available in local community centers like your senior center, the YMCA, even larger churches. And a lot of times a good resource, if you have a senior citizen center, is to reach out to them first because they'll probably have a list. And if not, you can look up, you can Google things like Silver Sneakers, Rock Steady Boxing. So a lot of times those things go on at churches too, like churches with big activity centers. That's a great way to get involved, again, with other people that are doing the same thing as you and with somebody to help lead you through the exercises. And those are usually free. And then the internet. The web is a great resource for any exercises, any kind of activity program. YouTube has tons and tons and tons of exercise programs, all the way from bodybuilding, if you think you're still at that stage in your life, all the way through like live recordings of people doing Silver Sneakers and things like that would apply more to you, chair yoga, things like that. There's even virtual exercise Zoom calls you can participate in. You can find online in your area, so that even if you can't physically get to the location, you're still accountable and still working with other people to get through that. And then a couple more resources. Excuse me. Therapy, that's us. So we have several HealthPRO Heritage Therapy clinics at a lot of the Morning Pointes. I'm at 3 Morning Pointes myself, where we have a clinic inside the building. We provide services on site for outpatient and home health without the need to transport to and from appointments. So if you're there, we're probably there too. Look us up. We're glad to help you. We work on personalized programs to improve strength, endurance, balance, self-care independence, cognition, everything. Swallowing, we have speech therapy, occupational therapy, physical therapy. It's all available. And we also intervene typically after any time there's a major event, like a fall, surgery, anything that needs that kind of therapeutic aftercare, orthopedic. We can do anything that a normal standalone clinic that's outside the building can do. We are our own business and our own clinic that's just located inside the building. And we also specialize in advanced care for dementia. I'll touch on that. We have a few specialty programs. I won't go over our programs too much. That's not what this talk's about. I just want to quickly make sure everybody knows these things are available because we can intervene to help develop exercise programs for anybody that needs it. We have ageless abilities. This program is 100% focused and based on what I talked about earlier about active engagement and meaningful occupation for people living with dementia. We use this program less to treat the patient and more to engage with the family and find out the person's past history, their interests, what their life is like, what will engage them in the future. And then we take that and we work with the patient to develop a program for activity and meaningful occupation that celebrates their quality of life improvements, even if they're in a state of advanced dementia. We've seen significant increases in quality of life, happiness, compliance, decrease in negative behaviors, that kind of stuff in this program. So please look us up if you have anybody in that situation. We're glad to help. Our standard stuff like Defying Gravity, which is a falls and balance program where we work with people to screen them for balance issues and work out the kinks before a fall happens. That's the best way to do it. It's preventative. You feel like you're not quite where you were before. You've had a decline, you feel weaker, you've had some issues, you feel less stable, or had some near misses where you've almost fallen. You're probably a candidate for this program. We want to work to make sure that we fix those before they turn into a fall, before there's a fracture, before there's an injury. We also use this program to step in after someone's had a fall to help fix those same issues. And just it's reactive in that situation, whereas we'd rather be proactive. So we're happy to do screenings to intervene and to kind of see where people are at. And if there's a need for therapy, we pick it up from there. Healthy Fit is basically, to sum up all this, it's a private pay. It's basically using the physical therapy team as your personal trainer. It's non-skilled, non-therapy. It's for people that oftentimes have finished therapy and want to continue the exercises, but don't necessarily have medically billable goals. Maybe you want to do high-level balance exercises that aren't safe to do alone, but you're able to do most of it on your own. You can progress to this program, and we can do it. Like I said, it's basically personal training. So we can set up once a week or 5 times a week, whatever somebody wants based on their needs. Just reach out to us and let us know. And finally, the comprehensive health and wellness screenings we do when somebody moves into our facilities to Morning Pointe. We offer this to do a baseline screening of 6 different measures of health, from balance to cognition, to get a baseline of where somebody's at, to help them be able to tell if there's been any changes in the future. And if we notice a need at that time, we'll bring it up to the resident or their caregiver and let them know what we think have seen and if there needs to be an intervention at that time. So to summarize, while most people are aware that exercise and activity are very important, it can often be let go, forgotten, especially as we age. It shouldn't be the case. The degree which it affects our health and our happiness and our cognition throughout our lives can't be overstated. It should never just be, I'm older, I don't need to exercise. The reality is, the older you get, the more you need to exercise to help compensate for some of those things come along getting older. And it can really make a huge impact on your physical health, your brain health, your emotional health. So thank you all so much for your time. And don't forget, always be active. So I appreciate you all listening. We're taking active questions in the chat. If you have any questions, please, I'm going to stop sharing my screen here. And I'm going to pull up the chat. Please feel free to ask anything. We're doing that for about 15 or 20 minutes. All right, so I'm going to pull some of these up and I'll start asking them. If you think of anything in the meantime, please feel free to reach out and put it in the chat and I'll read it off and answer it. So the first question I'm seeing, my mom continues to complain about her aches and pains and believes she needs to do less and less. Any suggestions on how to get over this wall, this block? Yes, so one of the first things I would try is education. You know, if your mom is just normally aging and feels that it's a normal part of aging, education on a lot of the stuff I just presented on is key. Showing how much, I mean, for me personally, if I was in that situation, showing how much it can help to stave off dementia and to improve dementia symptoms throughout our lives. The effect it can have on us when we're older on cognition. That's probably the biggest one for me. That's a lot of my patients' and residents' biggest fear. So that is one where you can say, hey, this has been shown in multiple studies to make a huge difference on how well you can think for yourself, how well you can take care of yourself. Some of the other stuff I would talk about is, you know, increased bone density, decreased risk of fractures, decreased risk of fall, increased happiness. And you can always bargain. I hate to say it that way, but it's the truth. That maybe try it for 3 weeks. See if you feel better after 3 weeks. See if it's too hard for you. If you really just give it 3 weeks, I'll leave you alone. But if you do 3 weeks and you feel like it's not that bad, then maybe we can continue. Or you can also set up, like I said, just increased activity in general. So working on maybe, like, Mom, I'm not trying to get you to train for the Olympics. I just want you to add an extra lap around the building once a day. And we'll build off that. Or just make sure you go to the exercise program. It's 30 minutes, your friends go, it's not very hard, and it'll really help you be happier and healthier. Excuse me. And then finally, offer to participate with them. If you think that would help and you're in the neighborhood, if you're available when you visit, if you're able to be there a few times a week, offer to participate, offer to be part of that exercise. It'll help you too. Even if you're already going to the gym, adding that little bit of extra walking is not going to hurt you. It will actually help you some as well. And it will definitely motivate your kid to know, your parent to know that you're coming out to exercise with them. You're coming out more to exercise with them. And that sometimes would be the biggest factor I can think of is increased socialization with family. All right, our next question. My father already shows signs of dementia. Would exercise help them lessen or pull back these effects? So I want to make sure I clarify on that. Someone who's already got dementia, who has already living with it and they've already gotten to a certain level, all of a sudden training with lots of exercise isn't going to take that away, but it can improve it. It's been clinically shown and proven to improve cognition. So maybe they're at, I'll just randomly say, we actually have measures for cognition, but just to make it easy, let's say there's a 0 to 10 for the dementia scale. That's not a real scale, but makes it easy to understand. And your dad's at a 5, where he's showing significant signs, but still able to live in assisted living, that kind of stuff. Starting a significant exercise program is not going to put them back to a 0, but maybe it'll move them to a 4, or maybe it'll keep them from progressing to a 6, 7, or 8 for a much longer interval. It will directly affect cognition in a positive way, a noticeable way, but it won't make it go away entirely, or it doesn't reduce the risk of getting it once you've already got it, but it does definitely, absolutely help, and I can't encourage it enough. Next question. My father has never exercised his entire life. How do I convince him to start something small? He lives by himself. He uses his ailments as the reason for nothing to do. Okay, that's a great one. So again, if somebody has never exercised their entire life and has no motivation to, it's going to be hard to get them to start lifting weights or doing something like that. They're probably not going to do it. So active engagement. Well, I keep going back to that, but finding something that is at least moderately physically demanding in some way that also involves something he enjoys doing. Anything from, maybe you live nearby, and again, you offer to go for walks with him, or maybe you don't live nearby, but maybe if he's safe to walk outside or alone, having him walk a pet, his pet or a neighbor's pet. In my building, we have people with pets, and some of them have lost the ability to walk as much as they'd like to, and some of the other residents volunteer to walk their pets just for fun, not because they're needed, because they want to. That kind of thing, that kind of engagement in an activity encourages that walking. And there's lots of things like that. So setting up, if he's maybe he's into model building model cars, model planes, maybe he's into woodworking, something like that he still participates in. Pushing him to do those kind of things is going to be much more successful, something that he enjoys doing, than just trying to get him to lift weights or something like that. So finding those kind of activities that are motivating to a person and actively engage them, and helping to prop those up, as long as they also include some kind of activity, can be a lot more successful and just as valuable. And also, you're killing two birds with one stone there. So you're getting the exercise, but you're also getting the active engagement and meaningful occupation. And you're going to get a lot of mood and cognitive improvements from that as well. A lot of improved sense of self-worth in completing activities. All right, next question. My parents exercise slightly, but they have horrible diets. Suggestion on making lifestyle changes. So for that's a little off topic on this one, I hate to say, but that's a whole nother seminar that we could go over on improving diet. The best thing that I would recommend for that is to work with their physician, or maybe have their physician, if they'll let you help, or ask them to get it themselves, have them recommend a dietitian, a trainer, somebody that can help with their diet. Again, education, I know we didn't go over diet at all on this, but looking up a lot of statistics on diet can really help with that a lot, showing that no matter how much you exercise, as much as it can help your your cardiovascular health, if all you eat is bacon every single day for breakfast, you're still going to have some issues with plaque in your arteries and also genetics. So it's just, I would say steer them to the doctor or to somebody like that to try and help intervene in that situation. Let's see, next question. My mother has dementia and her life expectancy is less than 6 months. Should I push her to participate in group exercise beyond the PT and OT we have scheduled so she can live as independently as possible? So that's a tougher one, and I understand where you're coming from with that question. I would say that in that situation, it's dependent on you as the caregiver and on your mom and how she feels about it and how well she participates. It's obviously not going to hurt to be more engaged into activity, to participate in increased activity. If especially if she's already getting PT and OT, they can probably help with some of those things. If they can set her up with some stuff that engages her and gives her enjoyment, actively engages her mind in some way, and also increases her physical activity that benefits her happiness and quality of life, I would say it is worth it. If you know for sure that somebody's life expectancy is less than 6 months, there's no reason to be pushing physically in a way that's going to tax them and make them feel worse. But if you're able to integrate those in a way that makes that person feel better, then there's absolutely reason to. We shouldn't hold off on good things because someone doesn't have a lot longer to live. Just like if they're children, like if you or I, if at 40 years old, if I found out I only had 6 months left to live, I wouldn't want to not do things. I wouldn't want to not participate in life. I wouldn't want to not have enjoyment from activities and just sit on the couch until my time came. And I would expect the same thing for somebody who maybe doesn't understand their situation, but is still living their life and is still here with us. So I would encourage whatever works for them, whatever you can do to help them be actively participating and happy. And if it's not working, then don't stress, don't sweat it. And just do what you can for them. What if they need therapy but refuse to go? So that is tricky. Again, that's really dependent on the person. So as a therapist, I can tell you if somebody refuses to go, like they are actively refusing, it depends on their cognitive level. If they're their own POA or they're taking care of their own health care, or even if their loved one is their POA, but they're still making their own basic decisions, they're just maybe not making financial ones or something like that, we can't force someone to participate in therapy. And never would, even if we could do that. If somebody has more advanced dementia and doesn't understand their situation, we will sometimes continue to pursue therapy. But even in that situation, if they are actively refusing, just cannot tolerate working with therapy, then it's not right to force someone into doing that. So I think in that situation, again, I'll go back, if they're cognitively sound, I'd go back to education. I'm trying to convince them why it's necessary. You can even bring your doctor or their therapy team into it on talking about why they need it so much and what the benefits are going to be for them depending on why they need it. But that's tricky. If they're absolutely refusing to go, I would say that's a different problem. You've got to work with them on what's motivating them. Why are they refusing to go, and try and chip away at those issues, which as therapists we're used to. We're used to explaining why we're doing things, and we're happy to do it. So you can come to the therapist for that specific issue for your specific person and ask what you can do to help convince your loved one to participate. All right, let's see. Next question. My loved one has had multiple sessions with both PT and OT while at the Lantern. He does well with them, but struggles to follow the routines they leave with him to continue movement. He's very sedentary, and there's nothing I can do to motivate him, including doing the routine with him. Although he's diagnosed with Alzheimer's, he is very cognizant and capable. He's just content sitting in his room watching TV. His stability is starting to wane, and he's at risk for falls. He refuses to use a cane or a walker. What can I or the facility do to help? The first thing that I would recommend is asking the PT and OT if you can sit in on the sessions that they're doing with him. If you've seen results, if you've seen them working with him and getting results, then there's something that can be done. He's benefiting from it in some way. Maybe they have a different approach. Maybe it's because it's a different person. A lot of times in memory care settings, what we do is more based on educating caregivers and family than it is the patient themselves. We'll come up with an exercise program that doesn't take that long to do, but getting a successful one that the person participates in on a regular basis can take a lot of caregiver and family education. So that's the first thing I would say. Ask them if you can sit in on a session and specifically tell them that you're doing that because you want them to teach you. You want them to show you how what they're doing is working, what they're doing differently. A lot of times it can come down to just the way we speak to our loved ones. It's a very hard thing to take on that clinical tone with somebody that you've spent your whole life with. But simple one-step commands and not asking opinions a lot of times for people that are living with dementia. So for instance, to make that more clear, not saying, Dad, it's time for your exercises. Do you want to come do your exercise with me? You know you need to. He's going to say no. Whereas maybe the therapist comes in and says, all right, Mr. Smith, come sit over here for me. All right, here's this weight. I want you to lift it 5 times. There's no question there. And if somebody wanted to refuse, they could do that. But it's no, do you want to exercise? Because that answer is going to be no every single time. And as our sons, daughters, wives, husbands, it can be very hard to shift gears to that mode for that person. But that's often a big factor in it. And again, maybe there's other approaches they're doing. Maybe they're setting things up differently if they're having success. And outside of that, I would just say, if he's very capable of doing things, again, finding something that engages him that he gets up off the couch to do. So I don't know if hopefully he's not diabetic in saying this, but if he has a sweet tooth and he's not diabetic, then saying something like, I'll give you candy if after your exercise, you do the whole program with me. At the end, maybe we can get some ice cream, something like that. You may have to remind him throughout it, but figuring out what motivates that person. All right, I'm going to look and see. I think that's all the questions that we have. Hopefully I was able to answer those reasonably for everybody. So we're going to wrap up. I want to thank everybody for coming and watching today. I appreciate everyone who came out. It was an important topic. I really hope that I was able to convey just how important it is. Again, especially for cognition and behavior. I think we all know how important it is for our bodies, but it goes so much beyond that. And I wanted to thank the Morning Pointe Foundation for setting this up. And I wanted to also say that if there's any continued questions or issues or chat or anything you want to talk about beyond this after I am off here, you can reach out to the Morning Pointe Foundation. Either now in the chat, even when I log off, this will still be up, or reach out to them directly through their website. All right. So I'm going to take off, everyone. Thank you so much. I appreciate your time and I hope you have a good evening.
Thank you again for joining us for another Morning Pointe Foundation virtual Caregiver Café. And thank you, Mr. Andrew Klope, an occupational therapist and therapy program manager for Rise Senior Living with HealthPRO Heritage Therapy, for sharing your expertise on the importance of continued exercise and active engagement as we age and its impact on health, fitness, cognition, and behavioral health. Be sure to join us on September 7th at 6:30 p.m. Eastern Standard Time for our next virtual Caregiver Café. The topic, Understanding Alzheimer's and Dementia. Our guest speaker is Dr. Matthew Kotze, PhD, and Vice President of Medical Affairs at CHI Memorial, and a well-known and long-time dementia care specialist. And don't forget, you can join us live at 6:30 p.m. Eastern Standard Time, or just by registering, you can watch at your convenience. Until next time, thank you for joining us for the bi-monthly Morning Pointe Foundation Caregiver Café virtual educational series. To learn more about the work of the foundation or watch any of our previous Caregiver Cafés, visit us at morningpointefoundation.com.